So good day everyone, my name is Zecris Enriquez. So for today, I am going to perform a post-mortem care turn demonstration. First, I'm examining the patient's record to verify that the physician has pronounced death and to take note of the time of death. I'm looking for any directives related to autopsy, organ donation, and documenting any pertinent cultural or religious factors. Next, I will communicate with the family to clarify the procedures for post-mortem care and the process of transferring to the morgue, making sure they comprehend and agree to move forward. Next, I confirm the patient's identity by using two identifiers like their full name and medical record number in accordance with facility policy. Next, I will be performing a hand hygiene. Then, I will put on my gloves, a PPE or personal protective equipment, a mask, and eye protection. To ensure privacy, put a polite sign outside the door, shut the door, and draw the curtain. Next, I will now determine whether the body presents a risk of infection and adhere to the facility's infection control protocol for appropriate labeling. And I'm examining the body for the presence of dressings, medical tubes, and additional equipment. Now for preparing water for bed bath, filling the wash basin with warm water to prepare for bathing. Next, lifting and smoothing out the bed, I'm carefully taking off the sheets, blankets, and the gown worn by the patient. If permitted by policy, I will detach any IV lines, catheters, and medical equipment. I'm taking out the dentures and glasses. These items will be put into a container to be included in the body bag later. If suitable, I will roll a towel under the chin to shut the mouth and carefully close the patient's eyes. Next, I will place an absorbent pad under the buttocks and performing a respectful bed bath as I would for a living patient. Next, creating a list of personal belongings, compiling an inventory of personal items, determining which will accompany the body and will be returned to the family, obtaining a signature for record keeping. Next, securing one-tag identification name tag to the patient's big toe. Next, prepare a body bag. completely opening the body bag and unzipping it, rolling one side up lengthwise. Next, I'll shift the patient onto one side, take away the dirty linens, and lay down a fresh fitted sheet, tucking it in as far as I can. Tucking the rolled body bag beneath the patient to ensure it covers the full length from head to toe. Turning the patient to the other side, finishing the linen change and unrolling the rest of the bag, zipping it close and gently. Wrapping the zip bag with a fresh flat sheet to preserve dignity during transportation. Next, including dentures and glasses in the body bag as needed, the third name tag will remain with the personal items to be handed over to the family. Attaching an additional name tag to the exterior of the bag, threading it through the both zippers. Next, assume that they arrange prompt transport to the mortuary, observing and supporting the family as needed during this time. Next, I will discard all used supplies properly and removing PPE and performing hand hygiene. And for the final procedure, it is necessary to record the complete process in the patient's file, encompassing details such as any tubes that were retained, personal belongings, names of individuals involved, timestamps, and the positioning of identification tags. This concludes the procedure for post-mortem care, carried out with respect, cultural awareness, and professionalism.